computer. Okay, very good. So I think people may just come on as we go through this, but thank you also very much for joining us here today. So Paula and I are with a shared vision and wanted to share with you, as you saw in the announcement that went out, the vision screening that we're currently using here in Colorado, and in particular to talk about what this means for pediatricians and their practices, that this is training that we have been providing since the pandemic started to help people with understanding how you can do vision screening via telehealth. And this is now reaching out to all of you to be able to incorporate some of these or to think about some of the lessons that we've learned through this process. I very much would welcome any feedback that you have as we go through this. Let's try to make this interactive, so please ask questions. I think you're on mute now, but if you'd like to ask, just go ahead and jump in. And Paula, if you could watch.
Can I jump in? We're not all on mute, so I'm just going to remind folks that if you're not on mute, we can hear what's going on. And Stephen or Paula, do you have a way to control mute on your side?
I think I do. So thanks for reminding me of that. And as I get a few, here we go. Now I'm going to adjust my screen so I can see you all, and then I'll see if someone. I know it's hard. This is as much as Zooming as we have done and telehealth as we have done, there's still a lot that we continue to struggle with from a norm standpoint. But again, I'm thrilled that you all are here to support this. So just very quickly about Paula and me, and really the Shared Vision organization. We are a Colorado 501c3 nonprofit. We founded back in 2016. So we really started seeing children in 2017, focused specifically on early intervention vision services for children that are blind or visually impaired. And since we started, we're the leading provider. Now, let me give a little context around that. Prior to 2017, we really didn't do the early intervention vision services that are asked for by federal legislation. So this is something we filled a gap and to bring our teachers together so that we could provide these services. We do this in partnership with 16 of the 20 CCBs here in Colorado. These are the community-centered boards that some of you may be familiar with. These are the agencies that provide case management services and other than the therapists and teachers to provide families that have individuals that have developmental delays and disabilities. This past year, and that represents about 85% of the population from when you look at all the counties around Colorado. And as you see me looking over here, that's because I'm looking at my presentation as well. This past year, we served about 200 children in total. We have 17 teachers of the visually impaired that support these families around the state. And we have 3 programs. So by far, the largest one and the most important one that really is associated with our primary mission is to provide these early intervention vision services. So in partnership with you, but particularly in partnership with our ophthalmologists and optometrists that are taking care of our little ones with visual impairments, blindness and visual impairments. We also provide family support events. So these are scaffoldings for families that can feel very isolated with a child that has a developmental delay or disability. So particularly, again, from a vision standpoint. And then we provide education like we're doing today, but we also then do this for our colleagues that really serve the ecosystem of birth to 3. So this is all of those OTs, PTs, SLPs, developmental interventionists, just the community of early childhood special educators, everyone that's out there, in addition to all of you, obviously, that support these little ones. Now, I mentioned that we are doing this in partnership and collaboration with Early Intervention Colorado. Early Intervention Colorado is part of the Department of Human Services and part of specifically the Office of Early Childhood. And this is the group that has the leadership role and in turn provides oversight for the CCBs around the state. This is specifically done as part of IDEA, the Individuals with Disabilities Education Act, Part C. So that provides the funding for our services and many of the other services that are provided for these these little ones and their parents, their caregivers. They provide comprehensive services for any child with developmental delays and disabilities. These services are provided in early intervention in families' homes. So the idea here is where children learn best, where research tells us, is to provide these services in their natural environment, in their home, and other natural environments where they might be, their library, the store that they're going to, the grocery store. So a variety of environments. And then, as I mentioned, these disabilities or these disciplines that we support And then also all of these, so that you're aware from a CCV standpoint in early intervention, all of these services are provided at no cost to families. And that's critical for all of you to understand as well and to feel good about this. Danny, you look like you may be on doing a little bit of a workout, which is great. That's a smart way of leveraging time during these Zoom calls. I applaud you for that. But again, these services are at no cost to families. So as you think about that there might be a need, don't hesitate to make sure that families are aware of these services that can support any of their children. So that's quick background. So now, why are we doing this? This is all about vision screening, as I mentioned to you before at the outset of this. This data point here, that Colorado supports just 25 to 50% of the very young children who are visually impaired or have vision concerns in the state, is from a benchmark study that we did in late 2019, well before the pandemic. We found that compared to New Mexico, Arizona, and Utah, we serve just a fraction of these children. Now, I mentioned to you before, there had just been this void in the state. So many times our CCV partners were not comfortable adding vision services onto an IFSP. So a little bit it was overlooked. Another aspect of this, though, is that we just have not done adequate vision screening. So we have been very focused to help all of you, the community that can provide vision screening, with the tools and the techniques to support the work that you're doing, and in some cases, providing the primary tools for those folks to be successful at screening. Now, the other aspect that I want to make sure that we're on a kind of the same page on is the reason that we're doing vision screening is we want to identify children that have some type of a vision concern that requires further evaluation by a pediatric eye doctor. So a pediatric ophthalmologist or optometrist that can do that evaluation, make the actual determination and diagnosis that supports something that you may notice that where there's a need. So as we have done this training with, we've now trained over 800 people around the state that are, again, our OTs, PTs, SLPs. But we've also, as we're reaching out to you as well, is to help people understand that why we're doing this. We need to identify these kids and we want to get them pointed in the right way. So just very quickly, the objectives that we have for this training, and I do want to pause at the end of this, just ask if there's any questions. And again, Paula, if you're watching the chat here, let me know. But to understand the importance of vision screening and the impact that it has on a child's global development. Second is to understand what vision screening protocol Colorado is using, because this may be something that that presents itself in your office. So as you all do things already, there's Early Intervention Colorado and Child Find and other names that you may be aware of are doing vision screening. And I'd like to share with you what those tools are. But then also understand what's new in that vision screening that previously had not been there. And that's around a child's visual behaviors. So many of you are familiar with neurological or brain-based visual impairment. CVI is that diagnosis that is often provided. That is now the majority of the children that we see with visual impairments have that diagnosis. And that is done through identifying a child's behaviors first and foremost, not through the physical examination of the eye. Also then to look at leveraging resources that are available for all of you. So if there are things today, we're going to present a number of things today that may be of value to you, would like you to be able to have those. I do not want to presume that I know more than you. I definitely do not. I am the executive director of this organization, and Paula isn't a teacher of the visually impaired. I am not. I'm a process person. I'm looking at the needs that we have in the community, and I want to just offer up with just some things that may be of help to you as you work with your little ones and their families. And then finally, understand who to contact. And that would be, we want you to be aware that we're here for ongoing support and training, and we don't charge. There is nothing that you're going to see that we are looking for any level of solicitation. It's just a matter of, we want you to know that as a nonprofit, we are driven by identifying these little ones, supporting the community that in turn supports these children. So we're here to help you. And so those are the objectives. So let me just stop for a second. Ellen, as we've talked about this, is there anything else that you'd like us to address today during this? Okay. The teachers that I work with often talk about the importance of wait time as you're working with a child who's visually impaired. So it's hard to wait on these Zoom calls, but it is important for me to take a deep breath every once in a while. Okay, so the agenda, we want to spend, I promised that this would be right around 45 minutes. So we're 10 minutes in, but want to talk about vision screening, the vision screening protocol. Take some time so you know what's coming out of the state, what's being used in the state. Discuss these supports that are available for all of you as part of your well child visits, and then wrap up. So number one, from an importance of vision screening, and this comes directly from the last time the state, and that's the Department of Education, Colorado Department of Education, develops the vision screening protocol that is used by our child find teams and others to identify these children. So it's separate from what is done with all of you with your well child visits. But this preamble, it helps us kind of set the stage that 1 out of 5 children have some type of vision concerns. That's 20% of the typical population. And we know that even with the children that we see in early intervention who are much more medically involved, much more challenged, we see a fraction of that number. So these children are just not getting identified. And the significance of that is these children that lack full visual access, this has a major impact on their attachment with their caregivers. It has a significant impact on their global development. So their cognitive, social, emotional, physical, communication development, these all are profoundly affected by vision. It's fundamental to their development. And we know that early intervention through research, that as we work with these children in birth to 3, we are helping them launch more successfully. They are then getting prepared for their ongoing development and for their support as they then enter into the school system or whatever ongoing education that they have. Just critically important. And I looked at Paula, just so you all know, Paula is a mother of a daughter who's blind, and she is now a incredible freshman in college doing just beautiful work. So it's important to identify and address these kids early and help them. Lastly, that as we talk with so many of our colleagues that are not all of you that are not medical doctors, but as we are working with others, we're surprised that we still identify children that need medical attention, that just haven't been seen yet by someone that is recognized. In fact, the story that I just saw very recently, we had a parent questionnaire that we're using this tool. And in there, for an 18-month-old child, they had an urgent vision concern that needed to get to a pediatric ophthalmologist for action. 18 months, and no one had identified it up to this point. So it's important that we use these tools correctly and get these little ones screened. And we ask, this is not a legislative mandate. We ask that we do this at least annually. And I share this more with my colleagues that are in early intervention so that we make it part of what they do. And then for all of you, as you work with children and their caregivers and the well child visits, that vision screening would be part of that as well. Now, I mentioned to you this, we did this study with our sister states, and I don't want to belabor this point, but just so you know, vision is a low incidence disability. So at the time that we did this back in November of 2019, all of the early intervention teachers are the visually impaired. So we are there to provide support for caregivers. We were just seeing collectively about 140 kids. You compare this though to our sister states, in particular a state like New Mexico, that when you do an age-adjusted population, so do the basic algebra, it would have been 800 children. So still a very, very small number, but much more significant than the number of children that we're seeing here in Colorado. So we're just not getting these kids identified and getting them the resources that they need. So now let's jump into the protocol that we're using here in the state. But before we do this, I want to set the kind of the basics. And again, I am not going to presume that I know what you do in your well child visits or how you do this, but I am going to quote from 2 sources here. So this is from the American Association for Pediatric Ophthalmology and Strabismus, as well as the American Academy of Ophthalmology. So they correlate in terms of what they would like to see in terms of vision screening. So this inspection of the eye, pupils, red reflex, corneal light reflex, photo screening, cover testing, visual acuity testing may all be things that you all are already doing. And if you think about the way they lay this out from a timeline standpoint, hospitals typically do this first part with the inspection of the eyes, and then getting into what you all do as pediatricians to do these other items that are age appropriate. Now, what's missing from here is behaviors. Is looking at a child's behaviors. Those 2 entities do not identify the child's visual behaviors that may indicate that there's a neurological or brain-based impairment that this child may be experiencing. So that visual impairment is identified through behaviors. And we're going to talk about that. But that's the challenge, the problem that we have with much of the vision screening that's occurring today. And again, this is not pointing fingers at anyone. This is from our ophthalmological community, well, that's a mouthful, to our optometric community, to our pediatricians, to anyone that is doing screening. We historically have not done this. In fact, in the state, I mentioned that 2005 vision screening protocol, that was the last time it was updated. We just now incorporated behaviors into our statewide protocol. So it's late in coming, but it's also a field that's emerging in terms of research, in terms of what we know. So here's what has then happened. When the pandemic hit, and literally Paul and I were in a meeting when the pandemic hit with our advisors, and one of those was from the Department of Education, we had to quickly exit and then look at what we could do to support vision screening when you can't do this in person. So again, I'm not presuming what's going on with you all as pediatricians, but the work that we're doing in early intervention had to pivot right away to telehealth. So we developed a questionnaire that's to be completed by the caregiver. So it's very, very parent-friendly language, and it helps those parents identify certain concerns or no concerns that can then come to someone who can score that questionnaire and make the determination of what those appropriate next steps should be. And those next steps should be, in many cases, not all the cases, and not the majority of the cases, but in many cases, to go to a pediatric eye doctor. And then also help to inform what should be happening in early intervention itself. So should there be a referral to early intervention? What should we add to that IFSP, that individual family services plan, that is the contract that identifies those services that are to be provided? And this was all developed by the Department of Education and Department of Early Childhood and Human Services. Now, why is this important for you? And this is the conversation that we had as to, what's in it for pediatricians about this? So there's a couple of things in here. And one of them is that a parent may show up in your office with this parent questionnaire. So if they have been given the parent questionnaire by Child Find or another group, they have concerns, they may walk into your office and show you this 4-page document. So I want you to be aware of just what's there so you're not surprised. Maybe you have already seen this. But there's also this point that I mentioned to you before about behaviors that is very significantly important. So very quickly, what's the parent questionnaire? It's 4 pages. There's general history, there's appearance of the eyes and eyelids, there's child's behaviors, and there's also then the caregiver's complaints or concerns. And again, these caregivers know their child the best. So what they might say then about their behaviors and their complaints, we need to listen to. I mentioned before that this is part of the Child Find team. So for those of you that are aware of Child Find team members, these are the organizations, the entities around the state that when someone self-identifies or through you identifies that there may be a delay or disability, they're first screened by Child Find, and they do the evaluations and assessments. So they use this parent questionnaire. The second thing is it's also then used within early intervention. So it's used there during the initial screenings for the IFSP, as well as we're hoping on an annual IFSP review so that we get to do an annual screen annually. And then finally, some of our home healthcare agencies, Solace, Alliance of Therapy, Spark, these groups are also leveraging the parent questionnaire to help identify when there might be vision needs that warrant some sort of follow-up with a pediatric eye doctor. So let's just go through the parent questionnaire. And again, if you have questions or comments, please let me know. And I think we're doing okay on time here. So first section is just the information about the child, the caregiver, the community center board that they're working with. But then there's a lot of general history information in here. This is the family history and medical risk factors. And why these items in particular are important is because these are indicators that there's a higher likelihood of a visual impairment. So not that it's saying that there is a visual impairment for the child, but each of these situations, so particularly around family histories, but also things like prematurity, exposed to alcohol or drugs before birth, a child is diagnosed with a syndrome like Down syndrome. These are all aspects. And as I'm seeing you all kind of trying to look at this, I'm happy to send this document to you so that you can read it more comfortably on your own. So, but again, these are just indicators that there is a higher likelihood of a visual impairment. Second thing then we go through is we turn to page 2 of this, we get into the ABCs. So the appearance of the eyes and eyelids first, then behaviors and complaints. So the appearance of the eyes and eyelids, I'm sure you are doing this today. So these are indications that a child should be referred, and sometimes urgently referred, not an emergency room urgent, but a call within the next 24 to 48 hours to get to see a pediatric ophthalmologist. So let me just kind of walk through these very quickly. So when you see one eye that looks significantly different, size, shape, placement on the face, that's an urgent referral. If you see an eye that turns inward or outward, and that's for a 2 to 3 year old with an abrupt onset, that would be urgent. Otherwise, it's still a referral. If you see the pupil or the iris is different, again, size, shape, color, that size difference is more than 1 millimeter, it's an urgent referral. And when I say urgent, by the way, this is not coming from me. One of our advisors is Dr. Robert Enzenauer, who used to be the head of pediatric ophthalmology until just very recently at Children's Hospital and the UC Health System. So he was very much instrumental in helping us identify when should something be that urgent referral to the eye doc. Now when one eye is cloudy or white, this could be cataracts, this could be a tumor, that's going to be an urgent referral. The eyes have that involuntary rapid motion, the nystagmus. If that's an abrupt onset, that would be urgent. If you see eyes are encrusted, the eye or eyelid, it's matted, encrusted, and you know it's not seasonal allergies, and you know it's not pink eye that we hope that you all would be able to take care of, we'd want to refer that on to a pediatric eye doctor, as well as if one eyelid is drooping lower than the other. So all of these visuals of inspections of an eye or eyelid would help us identify. Then we get into the behaviors. And again, I'm sharing with you the protocol that's being used. And I've sent to you a document that is the behavior list in a different format that you all might be able to leverage if you'd like. But this is the Parent Questionnaire. There's 19 statements on here that can be this indication of a neurological or brain-based issue. And we go through a couple of data views of this to determine whether we need to do the referral or not. And just so you know, from a credibility standpoint, this comes from a group in Europe. It's actually in Iceland and Belgium and the UK and Scotland. These are institutions and hospitals that are doing very leading edge work around CVI. So doing wonderful work. So not only about then the way to identify these little ones, but also how to support these little ones. And then finally on page 4, there are these follow-up questions. There's 4 at the top. There's a section here of just, do you have any other concerns? What we sometimes notice, and you may see as well, everything else may be negative, but a caregiver culturally or for whatever reason may sneak in or put in a little bit of a comment that concerns them. In early intervention, we want to make sure that even if it's as lightweight as, my child was prescribed glasses at 18 months and they just don't keep them on their face. We've tried everything. We've talked to our optometrist and we're struggling painfully so. Now, again, Paula and team, they don't have the magic answer on that, but we have a ton of tips and tricks, and including, we've been going through this as parents ourselves. So we're really good at helping those parents, giving them someone to talk to. And then finally, there's a question on that Parent Questionnaire of, is there a history of going to the eye doctor and what's the result? So I just shared with you that Parent Questionnaire. That's the protocol that we're using. So these are used by the other screening teams, and we provide training for those team members as how do you then score those 4 pages and make the appropriate determination. But I'm not presenting it to you to use, but I'm presenting it more to you so in case it does show up in your office, you know how to at least look at this, think about this, and then possibly answer this question again. Is there something that you see that requires further evaluation by a pediatric eye doctor? So the pediatric eye doctor, you all know, I don't need to tell you the difference between an ophthalmologist and an optometrist. We work with both. Now, the issues that we have in the state is that our ophthalmologists, pediatric ophthalmologists, are almost all in the Front Range. So they're Denver, Fort Collins, Colorado Springs. There's a group that goes out to Grand Junction and does weekly visits out there. But other than that, there really aren't pediatric ophthalmologists to support these children, and their needs are not geographically driven. Bounded in any way. So we have a number of pediatric optometrists. And again, some of you may know the Infant C program that provides free vision screening through optometrists. The Colorado Optometric Association is there. There are lookups, and I'll share with you how to find these eye doctors based on zip code and age group so that you can find the right referral. And what we found, the ophthalmologists and optometrists, while there can be differences in professional perspectives, they are very collaborative in helping each other and also getting to the neurologist when that's necessary. Now, the other point of referral is to someone like Paula. So as I mentioned to you, we have 17 teachers of the early interventions of the teachers of visually impaired. And the reason that we talk about referrals to these teachers as well as they partner with the doctors. They partner with you as well, where you make a medical diagnosis. And we've heard this from our ophthalmologists. They sit down with the caregivers and with the child. They sometimes have to convey very difficult news. And the last thing they say is, I want to see you again in X number of weeks or months. And until then, do the best that you can. And it's, again, you'll have a variety of ways of saying these things, but we are that stopgap often. We're the ones who will then see these caregivers on an ongoing basis and support those children on an ongoing basis. We are teachers of the children's caregivers so that they can be that optimal first teacher, help them with education, empowerment, and self-advocacy so they can support their child. We help the caregivers provide strategies so that that child can gain access to the physical world using all their senses. We focus on a child's global development. As I said, their cognitive, social, emotional, physical communication skills. We give them strategies and accommodations within the context of everyday routines. It's amazing as I've worked with these teachers to learn more about just how difficult bath time can be, feeding time can be when you have a child that's blind or visually impaired. And we help them with those routines and then help them bring in those strategies to generalize again for that child's global development. We do additional assessments that complement what you do. So if you identify a child with a visual impairment, we help with functional vision assessments and sensory assessments so those caregivers know how their child learns. We help them with CVI assessments if that's something that's necessary or needed by them. And then we also help them with adaptations of their environment for safety, for travel, and for learning. So many of our teachers are orientation and mobility specialists as well. So that's why in early intervention, we do referrals in two directions. We do one to the pediatric eye doctor and then the second to the teachers, because they can then help teachers make that appointment with the eye doc, prepare for the eye appointment, attend the eye appointment. We go to the eye appointments and take notes. So as medical information is shared rather rapidly, what does that all mean? How do I process this? And then help them with strategies going through this. So when someone uses the parent questionnaire and they make a determination that a referral is needed, this is what the referral form then looks like. So again, not suggesting that you use this, although this would be there for you if you'd like. So the majority of the kids would be no further action required at this time. And we just want to make sure that we rescreen your child annually. And again, we would hope that this would be part of the well child visits. The second thing is we may see that, remember the general history issues, those medical risk factors, family history. If there's something there, there's no other concerns identified, but we know that there's something in the general history that they're at a higher risk. We want to convey that to these caregivers. We don't say anything today about your child's vision, but there are some risk factors present, and we want you to be aware of that. And we'll give you a document that's we give this to the parents. It's available for you if you'd like as well. There's developmental milestones that are specific to vision so that a parent can monitor or track their vision, their child's visual development. And if anything becomes atypical developmentally, then they can then share that with you or with someone else so they can then get in and be rescreened again and evaluated. And then again, if concerns arise, we do tell them, please make sure you give your eye doctor a call so that you have follow-up there. Oh, this is the visual development guidelines. So this is available to families that's both in English and in Spanish. And as I mentioned, it's something that you can track as a caregiver, how your child is developing over time. So it starts at 1 month, looking at your face down to 26 to 42 months, matching 2 items that are the same color. So this can be very helpful. It's in the Department of Education. It's a great way for parents, caregivers to understand what's going on with their child's vision. Now, if there are vision concerns, and again, remember, this is for our child find teams in early intervention. If they see something that requires a referral, we have them then check this off and describe right in that blank line what it is that they notice. So when this form then presents to the eye doctor, or if it comes into your office, you know what we're seeing. If it's something associated with the eyes and eyelids, it's the behaviors, it's complaints, whatever that might be. So you have a heads up as to why they're showing up with you and why, and help those caregivers make that call to the eye doctor. And then if it's urgent, again, we want them to understand it's urgent. And again, we explain to them, urgent means call within 24 to 48 hours. And we help them with that so that if there's literacy is any issues, we'll help those parents make sure that they can make those calls. Now, that's the protocol that everyone else is using in the state. Now, that's a broad statement by saying everyone. That's the protocol that we hope is being used by our child find teams, our early intervention teams, our home health care agencies. And again, as I mentioned, this may show up in your offices for you to then also look at and evaluate. Now, additionally, there are aspects in there that we believe may be of value to you as you engage with your families and as you see and as you conduct the well child visits. So you are probably already doing aspects of this. And as I mentioned before, these behaviors can help us identify children that have that additional concern around their neurological or brain-based that could be a visual impairment as well. So I emailed this to you. This is one of the documents that you could use, for example, and again, I am not going to presume at all how you operate, but I know every time I go into my general practitioner for my, my annual checkup, I still have a clipboard that's given to me where I fill out a lot of stuff. And this could be one of those documents that you could ask the parents to complete, starting with the child who's 6 months or older. So this can help us identify these visual behaviors. And they break down into 2 sections. So in the top section, there are the first 5 where a child may cover or close an eye when looking at someone or something within close range. They frown or squint an eye when looking at something far away. They tilt, turn their head, lift, lower their chin, thrust their head forward or backward when looking at something near or far. They hold an object very close, or they have trouble seeing small objects such as a piece of cereal on their food tray. Any of those 5 should go to a pediatric eye doctor for evaluation. Those could be associated with a neurological or brain-based issue. Now, I probably skipped over this a little bit too quickly before. Some of these could be also behaviors could be associated with a child with autism. They may be somewhere on the spectrum, but we would want to make sure that we're ruling out vision as an issue as well. So that's why this questionnaire can be very, very critical. So even an autistic child may have a visual impairment. Let's find out. So now there's 15 more
Steve,
behaviors.
I'm sorry.
Yes.
Let me back to the previous slide very quickly.
Paul,
Those 5 questions there are all behaviors that we look for, as Steve said, that may help indicate some type of neurological visual impairment. But those top 5 also could be something as simple as a refractive error, or maybe, you know, this little one just needs some glasses to you know, fix how they're seeing. So those 5 are not just specific to CVI or neurological visual impairments.
Thanks, Paul. Then on these next 15. So again, these are the way we are doing this with our colleagues that are doing these child find and the EI vision screenings. We have, if there are 2 or more of these behaviors. Now, this is something we're going to continue to have to monitor, to look at. We didn't want to be so conservative that one is with just one behavior goes to an eye doctor every time. We're also aware of the referral process, the implications for insurance and payments for our families. As I mentioned to you before, once a child's in early intervention, the services are provided at no cost. But the services, again, to the community of medical providers, I don't get into that part of the work, but we're trying to just, again, be conservative enough at 2 or more that we want to have these children seen by a pediatric eye doctor. So again, this is a form that could be used by all of you. The second thing that we're providing to all of you, if it would be helpful, and again, do not want to presume to tell you anything. Please understand, I say this with humility. This is the rubric or the matrix that we use to make a determination of how should someone refer and when should someone refer to a pediatric eye doctor. So remember, this is being used not by physicians. This is being used by other therapists and service coordinators and others that are part of vision screening teams. So there are these items in here, this rubric that can be used, and I'll just walk through this very quickly so you can see. But as I mentioned to you before, if a child has any concerns in that general history, the refer over here says, refer if any concerns in other sections are identified, otherwise indicate no observable vision problems. Let them know there's a higher risk, let them know about those developmental milestones, and they can continue on. If there's appearance of the eyes and eyelids, that is a referral to both a pediatric eye doctor and an EI-TVI for the reasons I mentioned before. And we also help them understand that this could be an urgent referral. So again, that's in the scoring guidance that we provide. And if you would find it interesting for you or helpful for your staff to know about the parent questionnaire and the scoring guidance that we share with the others around the state, we provide very specific guidance as to when something is urgent versus not. You all use your professional medical judgment on this. Visual behaviors, if there's something there, we want to make sure that we do. So those are those things that could be neurological, brain-based. We'd want to refer to both a pediatric eye doctor and an EI-TVI, and note that that's not an urgent referral. It's a referral, but not urgent. If we find that parents have complaints, there's that section of does your child, there were 4 questions in there. We'd want to refer those on. I mentioned to you before that one complaint about I can't keep glasses on my little one. In early intervention, we want us to have an opportunity to talk to that family, because sometimes even as our teachers talk with a family about their eyeglasses and their frustrations, there may be something else underlying their concerns, something more significant, more deep. And we want to have an opportunity to give them a platform to talk about that, and then to potentially make a more thorough recommendation for ongoing services. And then finally, as you do your objective testing around the child's eyes, if you see a referral in there or a concern in there, you could then refer that on. So this again is offered for you, for your team members, if that would be of value, is to help. This is the guidance that Early Intervention Colorado would like to see from everyone. Again, this is a form that you could use if you would like. This is that referral form that I mentioned where you could check off the various concerns. And this form is in Spanish and English. So if you have a family that is Spanish speaking, you prefer to use that you certainly can as well. And then I mentioned to that this idea of knowing where the ophthalmologist and the optometrists are. So depending upon where you are physically located, I don't doubt that you know the community that is nearby. But just in case, there is a list of doctors, again, that we can share. It's on our website. As Paul and I are doing this training for you today, this is the first time we're doing this with pediatricians. So we'll put information on our website in a specific location so it's easy for you to get to. And we'll also follow up with you if you'd like to send these documents to you. But this is a downloadable PDF that you could give to the parents. It lists those pediatric ophthalmologists, as well as access to optometrists via zip code lookup that you can help your patients with, to know how to make that referral. So those are the supports. Now, for me, that feels like all of a sudden I've just dumped a lot on you. And I know that you have incredibly busy lives. You have a routine of how you do things. And we've had this discussion of how do we make this just as simple as possible? So I want to self-reflect just for a moment, again, why we did this. So to understand the importance of vision screening, I hope that you feel as compelled as we do. We need to identify these little ones. Understand how Colorado is doing this with that 4-page questionnaire, understand the importance of visual behaviors, looking at these resources and understanding who to contact. But now what do you do with these documents that I mentioned to you? I mentioned 7, well, actually 6, and there's a 7th one on here of things that you could use. So I want to share with you a little bit of I hope it's a little bit of a simple roadmap that you could use to then slot this in at the appropriate piece, or to give this to someone on your staff, if you have a staff, that could then also help you with how to slot these into the work that you do. So this form, and I'm going to walk through this in various sections, starts with you all conducting the vision screening itself. So up there, the ABCs of vision. So that was the appearance of the eyes and eyelids, the behaviors and concerns, as well as the objective testing that the ophthalmological societies and associations believe that you should do. There's these items up here. So once there's a tool in there to help you from a behavior standpoint, then once you, so that's this document, as I mentioned, that's this questionnaire of the behaviors. If you find that to be helpful, if you think that that would be something you'd want to add to the clipboard, it's available for you to use, or if you'd want to use it in some other way. So that second point that I mentioned about the rubric. So when you have scoring guides, so when you go through and you do your evaluation of a child's vision, and you want to then know, well, what would be the appropriate next steps? So then we have that scoring matrix or rubric in there for you. Again, if that's helpful, that's the guidance that we use here with everyone else. If that's helpful for you, that's available for you. Then down here are those, if you do believe that a referral is appropriate in some other capacity. So for example, if you identify a child that you don't believe has anything today with vision issues, but just because of general history, their risk factors and their own individual history, that you'd like them to have this vision development milestones, you could hand this to those caregivers. It's in Spanish and English again. So it's available for you to use and share with those families. Then if you do want to make a referral to a pediatric eye doctor, You could use this next steps form, again, in English and Spanish. If you want the list of pediatric eye doctors, we have that, so you know their contact information, so you can make that available. The local CCBs, again, I would not suggest that you hand out this 5-page document, but I'm assuming you all know who your CCB is or are. If you're on a border, you may have worked with 2 CCBs. More likely, you work with one of the CCBs that provide the early intervention services. But be able to provide that contact information. For example, if you're in Steamboat, you don't want to go to the 800 number in Denver. You'd like to know that it's Lindsay Gary that does early intervention. Here's her phone number. Here's her email address. Just call Lindsay. So it'd be nice to do that from a CCB standpoint. And then similarly, if it would be helpful, we have referral cards to us as well. So I mentioned to you that sometimes you have to give difficult news to a family, and you know that family may struggle a little bit for some reason. Families walk in, single parent, they have multiple siblings. There's probably 100 items on their to-do list already. You've now shared some additional information with them, and you say you need to call the eye doctor. We can help them with that. So you can give them this card, and our information's on there. We'll follow up immediately with them and then help them with whatever next steps you had suggested for them. So that is the body of what I wanted to share with you. So our contact information is here. Now you already have my email address from the emails that I sent to you. I'd be more than happy to share Paula's as well. Believe me, I know Paula is the subject matter expert here, not I. But if you want to reach out to me, I'd be more than happy to help you in any way. And as I said, to go through any of the materials that we presented today. If you'd like to do, anyone on you or your team would like to go through the training that we provide to others about how do you score that parent questionnaire, that's actually a 90-minute training. It provides you with rather in-depth practice so that you're immediately prepared to use this as a scoring tool if you'd like. There are then sessions that Paula and our other teachers provide about introduction to blindness and visual impairment, basic strategies for working with children that are blind or visually impaired. This may be of value to you, your staff, or it may be value to the families that you're working with. We're very happy to do this. And I promise you, this is not something we charge for. This is just fundamentally driven by the mission of who we are. We want you to know that these services are there. I am fortunate to work with an incredible group of teachers that are highly, highly skilled. And quite frankly, they support families that are children that are blind or visually impaired from birth to all ages. So we support the school systems as well. So we're not just restricted in our knowledge that ends at 3. They work with school age kiddos as well. So don't hesitate around that. I would like to ask one last favor. Feedback is critically important. If you don't mind, I'd like to give you an evaluation. It's the only thing I'm going to ask of you. I believe there's 8 or 9 questions on here. Most of these are strongly agree to disagree. There's a couple of yes, no's. This will just help Paula and me as we do this in the future. And again, Ellen, we're recording this. So if others would like to go through this, we can make it available for a recording, or we're happy to do this again live. So it's 1 minute till. We did this right on the 45-minute mark. We'll stick around. Paul and I'll stick around. If any of you have any questions or comments, would love to be able to answer any of those. But thank you so very, very much for your time today. My last point on here is just thank you. We need to identify these kids. We need your help.
Thank you, Stephen. I think folks are just filling out the evaluation, so I know that that's taking a little bit of time. But does anybody have any questions? Nancy, questions?
I do. Yeah, I was trying. It's hard to do 2 things at once. Thank you so much for this presentation. I learned a lot. I think my one question is, I'm from Colorado Springs. I'm a pediatrician in Colorado Springs. So it's pretty easy for me to know who the pediatric ophthalmologists are. But how did you make up the list for the pediatric optometrists? Because up to now, I'm like, oh, well, if you're healthy and, you know, on my acuity screening, you're 20, 30, but the parents don't have any concerns. I'm like, oh, just go see any old optometrist. I'm not really comfortable with saying that, so I'm very interested in that list. But again, how did did you choose the optometrist?
Yeah, so Nancy, we didn't specifically choose any one optometrist in here. We're not making a suggestion like that. What we're doing is we're providing you and your families with a zip code lookup. So these are from the Colorado Optometric Association, as well as with Infant C, those groups of pediatricians that provide those one-time free examinations for families. But what you can do is you can put in your zip code, and then you can put an age range in there as well. And that's important because you know, as pediatricians, that covers an age spectrum. Not everyone sees children that are 0 to 3 or whatever age group that you want. So just use that zip code lookup. That'll get you to your Colorado Springs community and help them even more specifically with their tighter zip code. What else?
Hey, thanks so much, Steve. This is Dan Nicholas. I'm a primary care provider at Children's Hospital Colorado. This is one of the topics I teach pediatric residents, so one of the reasons I was here. But the other thing is we have so many screening practices we do here in the Child Health Clinic, ASQ, MCHAT. We have a psychosocial screener, postpartum depression screening. I'm just wondering, like, you know, one other screening just seems like too much for our families to fill out. And how does this integrate or complement with some of the screeners that are already out there, such as the ASQ?
Paula, you would probably be better positioned to answer than I.
I think as far as the ASQ, I think that really is, again, looking more sort of at the global development. And if there are delays in any of those areas of global development, then I think maybe from there, it would be worth looking to see if vision is impacting that. So again, I think we both mentioned this. We know that it's just one more form they have to fill out. So it could perhaps be, you know, maybe a sub-screener, you know, if concerns show up on the MCHAT or the ASQ or any of those, maybe then the vision screener could be a secondary piece to that to, again, sort of rule out, could these be related to vision or visual concerns? And should we make a referral to ophthalmology, or should we go down another route?
And Dan, I think that, again, this is something that we see all the time. And I see this with my community center board partners as well. So they same issue, too many assessments, too much paper. So what we often do is present this as, here's the starting point. How can you incorporate this into other things that you're doing? So as Paula said, maybe it's, instead of it's 20, and by the way, if you like that behaviors, but would like to distill it down or want to do something else with it, I am truly more than happy to help with that. Because it's more about, again, what the biggest issue that we know is what we're doing isn't working. That's just fundamentally what I know. So, and I know that we're missing these children with potential CVI in particular, you know, specifically. So it's both the frequency of the assessment and then the thoroughness of the assessment. So as we're trying to address this on a couple of fronts here.
Well, and you hit on a really important point. I mean, I feel passionate about this topic, and I teach the residents this topic, and many of our residents, Denver is a beautiful, amazing, Colorado in general, place to live. So many go into practice here. So it'd be really nice to capture them at the right time. So thinking creatively around that, I think, is important.
We're also, Dan, and again, I realize Children's Hospital is a huge network. We are in conversations so we work with Kid Street today. I don't know if you're familiar with that. It's for children. They're very, okay. The other thing that we are talking with is to help with inpatient reviews as well. So to look at the birth of 3, provide inpatient services and support. And again, understand we do not do this because we're trying to make money. This is not a financial endeavor for us in the least. It's an endeavor of passion. So we really want to be able to work with whomever we can to help identify these children, and then work with you and your staff about what are those strategies for engaging with children that are blind and visually impaired. That's kind of the next thing. Once you've identified them, then what? And it's and that's where our teachers provide that complementary service to our eye doctors as well as to all of you. Here's how you engage. And again, as I said before, you cannot believe how frustrated parents are around just the everyday routines: playtime, reading time, bath time, feeding time. These are also profoundly affected by vision. What else?
Amanda, are you popping on because you have a question?
Oh, yeah, no, I'm just, I'm thinking. I work at a federally qualified health center in Commerce City. My patient population is 95% Latino and probably 95% Spanish speaking. And I'm trying to think like how I would ever implement this in my clinic. I got pushback for doing hemoglobin screens in 1 and 2 year olds uniformly. So like, I'm just really trying to think, and I don't think I have a good solution right now. I think I can just say that the temperature of the water is that everyone is burning out where we're working, and they're trying to increase us to 15 patient slots per half day. And that does not allow for a complete well child check even without this screen. So, fundamentally, I think that a lot of the problems that we're having in missing stuff in kids could be fixed by just giving providers more time to talk to parents and to examine their patients properly. I don't know that we need more, and I'm not opposed to this questionnaire, and I echo that I found it really interesting and a lot of the behaviors really fascinating to learn about and really important to learn to identify. But at the end of the day, I think part of the problem is we don't spend enough time with our patients. We don't spend enough time examining them. We don't spend enough time actually talking to the parents. And so we miss stuff. And as we add more paperwork, it doesn't always help. It sort of helps if you don't have enough time to talk to your patients, that they at least filled out a questionnaire, but it's not helping the root of the problem. We have a broken healthcare system, and the way providers are being asked to practice is not making healthcare any better. So I think we need to definitely brainstorm how we can incorporate this, if there's any way, into people's already day-to-day, would make it much more palatable rather than something else that needs to be distributed. I like Daniel's idea of like, maybe the ASQ needs an update. Maybe we could add, work with them to try to add some questions there, maybe, anything like that. And also I would consider even if it's bilingual, like a lot of people have trouble understanding what the root of a question is asking in an ASQ and an MChat in and of itself. Like the question is already complicated as is. So just to look out for that, because some of these questions seem really straightforward, but people can't fill out these questionnaires because they just don't understand what kind of behavior it's asking about. Sorry if that was bleak.
No, there's so much potentially to unpack within that, and there's just so much that is clearly outside of our ability to support. We are here to support you in any way that you think that we can be helpful. The example of this is we work with the early child Head Start teams as well, and their comments is that they can't use the questionnaire. They're going to use this in more of an interview format. It's primarily against Spanish-speaking families. So they're not going to have any level of expectations of literacy or complete on their own. So, that's just one comment there. The other thing is that for those families that once the screening's done and once we're able to get them into early intervention, that's where we then can also then have that additional time that you're talking about. So we can work with the parents that are outside of the clinical setting where there are so many time constraints on you. When we're with families, the frequency and intensity of our visits, we'll meet with families once a week for an hour or more, and we're in their homes, in their environment, so they can talk about their specific needs. So please understand, again, from a partnership standpoint, if there's things that we can do to help, let us know. That's one of the reasons why we want to get to all of the OTs, PTs, and SLPs and others, because they contact these families with a higher frequency than we do. They often see that hearing and vision is a problem that hadn't previously been addressed or screened. So we're trying to find these multiple backstops that can work in there. But Amanda, you hit on some profound issues that I recognize as well, and I wish you the very best. Well, again, I just want to say thank you. Thank you for your time today. Ellen, again, I'd like to check in with you, just anything that we can do to support you, to support your community. If you have ideas or thoughts, we'd love to get positive feedback from these evaluations, but we more importantly want your critical comments. If there's things that we can do to make this better, more helpful for you, more applicable for you, Amanda, to the issues that you bring, we're happy to help brainstorm. we're happy to help out in any way that we can, just so we can begin to carve out, get these little ones identified. But again, thank you so very, very much.
Thank you, Stephen. And so Alicia did confirm that we did get the updated link to a shared vision in our website. So that's there. And, I think this information is it's really useful, right? I think the challenge is how it was highlighted, right? That just so much happening.
Yeah.
Right. And I'm not a pediatrician, but as a parent, I think it's very confusing for, an optometrist versus an ophthalmologist. And my kid developed exotropia like in 3rd grade. So get this eye that, like, and we saw Dr. Enzenauer actually. And I mean, there's nothing, right? But we're like, are we sure there's nothing, And then you go to an optometrist because it looks really concerning and weird. And so then you're like, is there something we should be doing? And, the optometrist talks about eye training and eye exercise, which the ophthalmologists are like, that's just not helpful. And so I think as a parent getting this information, it's challenging. I mean, Paula, you probably know way better. And that was a long time ago that you probably had to navigate and learn differently.
Yes. And you're right. It's balancing the emotions of all of it and then the